same level, and then try it again on the resident. At this time, and it's a very good time to take a look at the tips on the bottom of the walker to check for wear and to make sure that they have remained non-skid. We then will check it again and see that the hand rest is at the bend of the wrist. Another way to show it is that when the hands are on the hand rest, that we have a 20 to 30 degree bend at the elbow. Now, to begin walking with the patient, you of course have placed a safety belt on. Your hand is securely in the middle of their back. In order to advance the walker, you want all 4 legs to hit securely on the ground. You do not want to be doing the 2 plus 2, where you have put 2 legs, have them start walking, and then the other 2, which puts them in a balance deficit. So to begin walking, we'll put the walker forward at a comfortable position. There is no waist bend. Once the waist bends, you're putting it too far ahead. And then the resident will take a step with the weak leg and then the strong. And at that time, move the walker again. So there are 3 steps: walker, weak leg, and then strong. And again, walker, the weak leg, and then the strong. You as an assistant will be standing slightly behind and on the weak side. Now that we've seen how to use a walker properly, what about a cane? A cane offers less stability. The cane should always be used on the unaffected side. That would be the side that would be considered to be stronger. This is important that the weight be transferred to the strong side and used on the strong side as opposed to on the weak side. It is also assists in keeping an upright posture. We don't want to add a poor posture to an already ailing body. Let's take a look at walking with the cane. Much like the walker, we want the hand rest to be at the bend of her wrist. This is too tall. With this particular cane, there is an area that needs to be, nut that needs to be unscrewed first. We push in the button and pop it in and tighten at the bottom. With a quad cane, we have 4 legs. The legs that are straight go next to the resident, and the ones that stick out to the side go out to the side. Okay. We're going to be using the cane on the strong side, and the guarding where you will be standing will be on the weak side. When walking, you will first have the resident advance the cane first, and a short distance. If it is too far, it will again put them off balance. Then it will be the weak leg, and then the strong leg. And the cane, weak leg, and strong leg. Once they become proficient, they can then use the cane with the weak leg at the same time, and the strong leg second. So that'd be cane and weak leg, and then the strong leg. Again, you will be guarding from the side and slightly behind. Now that we've seen ambulation with the cane, what about crutches? Crutches are an assistive device that requires a fair amount of muscle coordination, balance, and motor control. Fitting of a crutch is crucial. At no time should one rest their armpits on the top of the crutch. There are nerves and arteries that are very superficial at this point, and they can be impeded. This would cause something called crutch palsy, in which the resident would lose function of their hand. Let's take a look at fitting and walking with crutches. With the crutches, it's a little more complicated for fitting. It is important to note the majority of your residents will have already been fitted properly by the professional that prescribed the crutches initially. What we are going to be looking at is 2 things. One is the height of the crutch. The height of the crutch should be such that when it is placed underneath the arm, that there are 2 to 4 fingers that can fit between the top of the crutch and the armpit. This is too tall. To change it, we have the same push button mechanism. and to pop that in. The second thing, now that we put this back, we'll then take our 2 to 4 fingers in between the top of the crutch and the armpit, and in this case we can get 3 fingers in there comfortably. The next thing we will check is the hand rest. Again, we are looking for it to be at the bend of the wrist. This requires actually a nut and bolt type thing. If you take out the bolt and just slide it up and then place the bolts back in. And we'll check that. Oops, at the bend of her wrist. So when she puts her hand on it, we have a 20 to 30 degree bend at the elbow. When using crutches, it is important that at no time would the resident be resting their armpit on the top of the crutch. There are very superficial arteries and nerves that will then become pressured and can become damaged, which would mean loss of function in the hand. So anytime using the crutches, the top of the crutch pad is not for the armpit, but for the torso, and should be pressed against the torso at all times. We've placed a safety belt on and are grabbing in the small of the back. In order to sequence this, we will want first the weak leg to move, squinch the crutches close to the torso, move them forward, and then the strong leg. And again, weak leg, then the crutches, and the strong leg. At no time during walking or standing should the resident at all be resting their armpit on the top of that crutch. Remember to watch not only your body mechanics, but also the residents throughout ambulation. We've now seen safety and guarding with transferring, walking without assistive device, as well as with a crutch, cane, or walker. Remember to plan out your task, use your head, and take time for a safe activity, whether it be transferring or ambulation. I hope you gained valuable information to keep both yourself and your residents safe and free from injury. Thank you for your time.